Ready? Knock, knock.
Come in.
Hello.
Hi.
I'm Brenda. I'm going to be your student nurse today. How are we doing?
I'm all right.
Okay, that's good. Can you verify your name and date of birth for me?
Yeah, my name's John Doe, 5'15", about 73 years ago.
Okay, about 73 years ago. Okay, and do you have any allergies?
Nah.
Alrighty. So I have an order today from the doctor for you to get an NG tube. And so that's just a tube that's going to go through your nose, down your esophagus, into your stomach. It's going to drain the contents, empty a little bit, and relieve some pressure for you.
Sounds good.
Sounds great. We love to hear it. Okay, and so I got what I need here. I got a towel in case anything comes out when I want to get it on you. I got my NG tube, my emesis basin, and then syringe, tongue compressor to feed. Okay, and then we got some water here, and my tape. Okay, so this procedure is going to be very uncomfortable, but there shouldn't be any pain, okay? And then if at any time you need a break, you just raise your hand and let me know, okay?
Okay.
Okay, so before we begin, have you had any head trauma, anything, any
No,
surgeries
nothing
to
like
your
that.
face or anything like that?
Mm-mm.
Okay, good. And what side do you breathe out of better?
I usually breathe out of my right side better, I guess
Okay.
you'd say. That's
All
a
right,
weird
so
question.
I'm going to give you a tissue. Blow your nose for me. Okay, good. And can you breathe out this side? Okay, and breathe out that side. Okay, yeah, it does seem like your right's better. Okay, so I'm going to get this towel up here, okay? And we're going to change my gloves because we blue boogies. And so, we do hand hygiene. We're not gonna wave our hands. You feel me? Alright, so new set of gloves. Okay. And now I'm going to do what we call, no I'm not. I'm going to assess your bowel sounds. Okay, so I'm going to listen to each quadrant for a minute each, and I'm going to start with the right. Okay, so your bowel sounds are active. Okay, and now I'm going to do, fix you back up there. Oh, jeez. Put your towel back. Okay, now I'm going to do a next measurement. And I'm going to measure starting from the nose, and then I'm going to go to your ear. And then I'm going to go down to your xiphoid process. Okay, which is about right there. And then I'm going to take that off. I did not prepare my tape. Okay. It's just like at about 58, looks like. Okay. So I'm going to put your towel back. Okay, I got my lube here. And my tongue compressor is in case it starts curling up back there. I need to look in there. Okay. I'm gonna look in your nose, make sure nothing's in there. Blocking me in your mouth. Say Your tongue's in my Okay, thank you. Alright. So now I'm gonna prepare my tape. And this is not a sterile procedure, it's clean. Okay, so this. Okay, and I'm gonna put the syringe on the end in case anything tries to spit back at me. Okay, we're gonna leave here. Okay, and I'm gonna put my hand behind your head just to give some support, okay?
Okay.
All right, now I want you to take a breath for me. Okay, good, good. Okay, we're backing, so we'll wait a second. Okay, and now I want you to swallow. Swallow. Okay, good. I'm gonna hold it in. Okay, and now I'm going to put the tape. I'm gonna wrap it around, and then wrap this other way. Okay, to get it in place. Okay, and now I'm gonna make sure I'm in the right spot. Okay, and I have stomach contents, so I'm gonna put those back. If I was not in the right spot, I would have gotten nothing, and I would just take the tube out, give a break, and then I'd put it back, redo it, basically. Okay, and then the best way to actually check for placement is to go down to x-ray, they do x-ray, see that it's in the right spot. Okay. Back on track. Okay, now I'm going to hook you up to suction. Okay, so we're gonna put this part right here, and this goes up here. Okay, and now we're gonna connect you. Okay, and then we're gonna turn it on. It's gonna be on intermittent, and we're gonna put it between 40 to 60. Okay, and we're going, and it's a draining. Okay, and so now I'm gonna verbalize what I would do if I were to give meds. If I were to give meds, I would turn off the suction for 30 minutes, and then I would crush up the meds really good, put them in water, make sure they're dissolved completely, and then I would put this syringe into this tube. I would clamp it off. We're still hooked up to suction, so I would clamp it off, and then I would flush with 30, and then clamp it before it got all the way down so there wouldn't be any air, and then I would do a med. If there were multiple meds, I would flush with 5 mils in between each med, and then once I was all done, I would clamp before it got empty, and then I would flush with 30 more. Then I would wait 30 minutes before hooking it back up to suction, and I would put a sign that says no hooking up for 30 minutes. Come back, hook it up to suction. Okay, so now I'm coming back. Oh. Okay. Hello.
Hey.
I'm back, and I'm here to do a bolus feeding for you.
Okay.
So, okay. Can get some new gloves. Okay. Excuse me. Okay. So I'm going to turn off the suction. And then I'm going to disconnect you here. Oh, but before I get started, I'm going to check the placement. Okay, it looks like it's still in the right place. Okay, and then anytime you do anything with a tube, you check residual, but it's been hooked up to suction, so I don't need to do that. Okay, and now I'm gonna put this in here, clamp it off. Okay, and I'm gonna flush with 30. Boom. Okay, let it go. Stop it before it gets completely down. Okay, and now I'm going to do my tube feeding, and I'm going to a little bit at a time, around 15 mils or so. Okay, and each time I'm making sure that I stop it before it gets completely past the needle. Okay, and then at the end I'm going to flush with 30 more mils of water. Okay, And now, okay. Then I'd hook you back up to suction. Okay, and if the NG tube was clogged, I would irrigate it and then aspirate to make sure everything is going. That's how I would start, and I would irrigate it with whatever the doctor has ordered and however much of the solution the doctor has ordered. Okay, now, okay, coming back at my cave. So you're doing much better. So now I have a order to remove your tube. Okay, and so now, never took your towel. This towel would not have been used up. So I'm putting in a new towel. Okay, and so I've turned off suction, got you not hooked up. Okay, and I'm gonna put this here. Okay, and so now I'm going to take your tape off. Okay, and then I want you to take a big breath and blow out for me, okay? All right, good job. Okay, and we're gonna throw this in the trash. Okay, let's wipe you up, and you can blow. Okay. And would you like to do any oral care?
Yeah, could I like swish some water around or something?
Yeah, you can. So here you go. We'll swish and spit. Okay, good job. All right, and then I have your call lights in place. Is there anything else you need from me today?
Nah.
Okay, well, I will. You just let me know if you need anything. Hit your call light. I'll get out your hair. Thank you.